We're going to have to debate this. Let's welcome back Governor Howard Dean. Joining us now, health policy expert Betsy McCaughey, author of the book Beating Obamacare. Daniel Kessler in today's Wall Street Journal from Stanford University takes the president to task, Betsy. He's saying you have your own insurance today. You will not be affected. Premiums, you will not have to change your policies. Is that true?
The president's lying through his teeth. And by the way, he also used the politician's F word, free, claiming that the preventive care that people are getting through their insurance policies is free. Actually, they're paying for it up front in their premiums, and getting a colonoscopy isn't so bad, but having to pay for one, whether you want it or not, feels really bad. But the point is that people who already have insurance will be very affected. The 25 million people in the individual market who already have insurance will see double-digit premiums. Somewhere between 7 and 30 million people who have coverage will lose it. The Congressional Budget Office says 7 million. McKinsey and Company and others say as many as 30 million. About 3 million will have their hours cut because employers want to stay below the 30-hour full-time job mark. And the 50 million people who are on Medicare, well, they're paying for over half this law. Medicare cuts pay for over half this law. So, in fact, many, many millions of Americans are going to be affected.
Interesting. Howard, this guy Kessler argues today in the Journal. He uses the number 40 million. He said 40 million people are going to be changed. And he cited some of the things Betsy cited. He also said they're not going to be able to see their doctors. Well, he also said that it's going to be much more expensive. Is he wrong? I mean, President Obama ought to level with the American people.
He's mostly wrong. First of all, and there's a lot of stuff that Betsy said which is not entirely so. It is technically true that a lot of this is paid for by Medicare cuts. They're all paid for by provider Medicare's cuts, and virtually none of it is paid for by patient cuts. Furthermore, patients
Untrue.
Well, we disagree. Patients, first of all, patients get a better deal because the donut hole gets closed on Medicare. So that Medicare patients actually come out ahead on this. First of all,
just tell me, I still don't understand. If the providers, you're talking about doctors,
right, hospitals.
If the providers are damaged by this, how can the patient not be damaged by this at some point in time? That's the part I've never understood.
Ultimately, they will be, because cutting Medicare or anybody else's provider payments is not the right thing to do. You have to fundamentally change the way we pay for medicine. You've got to pay by the patient and stop paying by the procedure. Otherwise, no form of cost control is ever going to do any good. The fact is, and I didn't support this bill, but there's some things in it that are going to be good. One, I agree with Betsy that McKinsey's right, 30 million people are going to lose their health insurance out of the private sector, but they're going to go into the public sector with government subsidy, and it's going to break the link between employment and health insurance. I think that's a good thing. People disagree, but it's a good thing in the long run.
Betsy, this is a narrow point but an important point. One of the reasons Max Baucus talked about a train wreck is that regarding these health insurance markets, these exchanges that they're setting up, the infrastructure is not there. It's not even remotely there. That's what triggered Baucus' statement in the first place.
Well, that's right. And in fact, the Department of Labor originally told all employers to write letters to their employees last March 1st, alerting them to the existence of these exchanges, which were supposed to open October 1st. Then the Labor Department more recently sent a letter to employers saying, don't tell your employees about the exchanges, implying that they won't be ready.
Well, when are they supposed to be ready?
They're supposed to be ready October 1st. Right. And by the way, it's not just whether they're going to be ready, Larry.
This is where we're coming into May.
They are billed as providing a huge range of choices for people who need insurance. But in fact, it's like going to a supermarket that only sells cereal. They only sell one thing, the government-mandated essential benefit package. And you'll see...
No, that's not true. That's actually not true. There's a minimum essential benefit package, but there's also there's the gold, the platinum, and all this other stuff.
No, I was just going to make that point. Bronze, silver, gold, platinum.
Right.
This is not Tiffany's. Those plans have the same essential benefit package, only the copays and deductibles differ. In the bronze
but the essential benefit package is very good.
You're forced to buy it. It's like being forced to buy a fully loaded Cadillac. Some people just want a Honda. It's like being forced to buy auto insurance that covers oil changes, wiper blades, car washes.
I did this, Larry, in my state 20 years ago. We drove essentially the insurance companies that were charlatans out of the market that were taking 50% of every premium.
It's taking choice. You say you're pro-choice? You're not pro-choice about insurance.
We took the choice of buying crappy insurance from cheats away from the people of Vermont 20 years ago. My market works.
Do you realize a 50-year-old couple has to buy maternity coverage?
part of community rating, and it's not ridiculous. Because if you say that, then you're going to be selling, ridiculous products.
Okay.
But Howard,
the straight arrow has to buy inpatient heroin addiction treatment.
Well, that's the thing. Just look.
That's what community rating is.
26, 7-year-old, first job,
right.
Doesn't have a lot of money to pay, would like to have some health insurance, but they'd like to have the Chevrolet model, not the Cadillac model. You can't do this.
The way you decide...
They're not going to come in until and unless they get real sick later on.
Let me tell you...
The cheapest Ron's plan is going to be $20,000 a year for a family with 3 kids, and you're still going to have to pay 40% of your health insurance bills out of pocket.
First
Who
of
can
all,
afford that?
The last word is this. This is not a train wreck. The states that have put in their own exchanges are going to do better than the states that bailed out, because there's going to be one single federal exchange. That's what the Republicans chose to do by not doing this. And the exchanges were actually invented by Mitt Romney and the Heritage Foundation, and I think they're going to work very well.
I just think
this gives people more choices, not fewer choices.
All right, I don't like to plan myself, but I'll just say this. We're coming into May. This thing's supposed to start in October. The infrastructure is just not in place. That's what Max.
It is in some states, but the federal exchange, I think, is going to